All right, let's prepare to continue facial treatments. We talked about the benefits of those treatments. Now let's move forward in some product equipment and preparing for the actual services.
In order to make informed decisions for their clients, estheticians must know about skin analysis, contraindications, technological advances, and how and when to use specific equipment and products. Communicating well with your clients will make you more successful. Good communication is part of getting, servicing, and especially retaining clients. Communication in the treatment room includes informed decisions for their clients. Estheticians must know about skin analysis,
Hold on.
contraindications, answering technological advances, and how and when to use specific equipment and products. Communicating well with your clients will make you more successful. Good communication is part of getting, servicing, and especially retaining clients. Communication in the treatment room includes explaining the benefits of products and services, answering
Let me take
questions,
this all the way
providing a
back.
skin analysis and educational information.
I think I got to repeat somewhere. Let's just
In
take
order to
it
make
back.
informed decisions for their clients, estheticians must know about skin analysis, contraindications, technological advances, and how and when to use specific equipment and products. Communicating well with your clients will make you more successful. Good communication is part of getting, servicing, and especially retaining clients. Communication in the treatment room includes explaining the benefits of products and services, answering questions, providing a skin analysis and educational information.
All right. So it talks about us having a great understanding and background of what we're doing. We closed in our basic facial steps. We talked about our traditional facial steps, um, along with those treatments as well. Let's look at our procedure checklist. We started to go over that yesterday. Okay. As we look at this procedure checklist, this is the skin analysis checklist. You always want to make sure you look at the skin, you touch the skin, you want to ask questions, and most importantly, you want to listen to the client. All right. So here's a couple of things before we even do a facial that we're looking at. Okay. Look for an obvious skin conditions and note the skin type. You're looking for something that is out of line, out of alignment, things that stick out to you. Okay. What are the skin conditions? Is this person has anything going on that needs some immediate consultation? Okay. Is there, do you notice the client itching? Is there redness? Is there dry skin? Also, what's the skin type? Is it oily, dry, combination, normal? Okay. What Fitzpatrick are they? Are they Fitzpatrick 1 and 2, 3 or 4? Where are they on a Glogos scale? Those are great components to observe prior to you servicing a client, especially for the first time. You're going to touch the skin. Okay, you're looking for elasticity. How well does the skin bounce back? Or is the skin sagging? Is the skin tight? Okay, is it loose? You're looking for the softness of the skin. Okay, because people want, if they're going to get your services, the most important thing they want to reduce wrinkles and they want a softer skin. Okay, you're looking at the texture of the skin. All right. the texture of the skin, and also are there any skin conditions, skin infections? If it are infections, you won't be able to serve them. Are there any acne present, rosacea? Okay, you're going to continue with the consultation. You're definitely making a note of anything that is not a part of the normal skincare routine. Signs of disorders. Where are the wrinkles? Are there any broken capillaries? Are there any weak muscle tones? Do we have a sagging or drooping in the face or in the jaw area? Are the pores extra large? Hydration levels. Is the skin really, really dry? Okay. And we're also going to note what products they've been using. We're going to choose those products to go forward as well. And we're going to note the information on the client's chart. All right. So those are going to be some key components that we're going to note. And that is the checklist prior to. We'll go back into our ebook and talk consultations um, and things of that nature. Let's move. I wanted to show another video. This is a treatment for sensitive skin, rosacea.
A sensitive, common skin condition called rosacea, a vascular disorder that causes swelling, papules, pustules, and distended capillaries known as telangiectasia, is prone to chronic redness and can be treated similarly to other types of sensitive skin. A soothing gel mask can greatly tone down redness and calm your client's skin. Any kind of heat is contraindicated in this skin condition as it increases blood flow to the surface of the skin, which can further exaggerate capillary damage as well as further break down an already compromised skin barrier. To complete the specialized treatment for sensitive skin, you may apply a gentle toner, followed by a moisturizing cream infused with lipids and non-irritating sunscreen.
All right. So it gives you just a little bit about rosacea and sensitive skin. You're going to use products that are not fragrant, less irritating. You're going to always keep something cool around, whether it's a cool towel or cool stones, because they're going to reduce inflammation. And if the product is very warming to the face, it can cause irritation, and the irritation could turn into heat. All right. So when we talk about servicing clients with sensitive skin or rosacea skin, we want to have those notes. We want the products to be as clean as possible. Um, they will not require a lot of touching, a lot of rubbing, because it's just like rubbing a stone. You're going to start a fire. All right. And so you want to keep the products as clean as possible. Apply them as needed, no over rubbing or saturation. Let's see what we got. Hold on one moment. Okay. We're looking at our pre service here, that preparation, preparing the client for treatment. The pre service is about 4 pages. We'll get that downloaded, sent over to you, but that should be something that is referenced as well. Okay. So we have that downloaded. You can print it out or download it, save it on your computer or phone. The pre service is what everyone needs. It shows what equipment to have out, what implements, what tools and products that we're going to use. Going forward in a lot of our services, you will have a pre service, the actual service checklist, and also the post service checklist. All right. The pre service, of course, is us preparing we're preparing for the service. We're getting the room ready, the products ready. We're not getting ready when the client comes in. We're going to perform the service when the clients come in. And when they're done, it is the post service, okay? Checklist. What happens after the checklist? So we update our vital docs. And also at the same time, it's a part of our cleaning routine. Okay, that is the post service. Of course, as it states here, you're going to greet the client, you're going to discuss and complete the client intake. You're going to talk about contraindications. Those are things that are going to prevent us from servicing the client. Okay. And that is our pre. We'll have our equipment out, we'll have a mini chit chat, a little observation, and then we'll move on to the next thing. Let's do a video in preparing the client for treatment.
Your client has arrived. Take one last look at your supplies and the room. Make sure your equipment is placed for ease of use and client safety. Okay, let's get going and prepare your client for treatment. Greet your client in a professional but friendly way, shaking their hand and making eye contact while introducing yourself. Review the client intake forms and conduct a client consultation, asking about any concerns and expectations for today's service. Discuss a treatment plan. Remember to ask your client if they have any contraindications, such as sunburn, sores, recent microdermabrasion, or surgery. Again, check the chapter on facials for a complete list of contraindications. Have your client sign a consent form before every service. Give your client a robe or wrap, slippers, and sealable plastic bag to store any jewelry. Explain which clothing may need to be removed and show them how to put on the spa wrap. You may also instruct them how to get onto the table and where to place their head for the service. Depending on the service to be performed, tell the client to either face down or face up on the table, then allow them to undress privately. Always knock before re-entering the room. You are now ready to perform the requested treatment. Place a bolster under their knees to relieve pressure on the lower back if they are facing up. If your client is facing down, always place a rolled towel or small bolster under their ankles. Bring the second sheet up and across the décolleté and place the second hand towel across the chest on top of the covers. Now that the client is comfortable, we need to protect the client's hair with proper draping. During setup, you place the towel on the headrest. Fold the towel into a triangle from one of the top corners to the opposite lower corner and place it over the headrest with the fold facing down. The client places their head on the folded towel, and the esthetician now brings the ends of the towel up to the center of the client's forehead to cover the hairline. Use a disposable headband to hold the towel in place and a spatula to tuck in the hair. Make sure the client's earlobes aren't bent and the towel isn't too tightly wrapped. As always before a service, wash your hands with warm water and soap and put on gloves. Now you can check your client's skin before cleansing. Your client has arrived. Magnifying lamp or the naked eye. Look at your supplies and the skin's natural state before cleansing, and then again after cleansing. Client safety. If not a pump, let's get going and prepare your client for treatment. Greet your client in a professional but friendly way, shaking their hand and making eye contact while introducing yourself. Review the client intake forms and conduct a client consultation, asking about any concerns and expectations for today's service. Discuss a treatment plan. Remember to ask your client if they have any contraindications, such as sunburn, sores, recent microdermabrasion, or surgery. Again, explain which clothing may need to be removed and show them how to put on the spa wrap. You may also instruct them how to get onto the table and where to place their head for the service. Depending on the service to be performed, tell the client to either face down or face up on the table, then allow them to undress privately. Always knock before re-entering the room. You are now ready to perform the requested treatment. Place a bolster under their knees to relieve pressure on the lower back if they are facing up. If your client is facing down, always place a rolled towel or small bolster under their ankles. Bring the second sheet up and across the décolleté and place the second hand towel across the chest on top of the covers. Now that the client is comfortable, we need to protect the client's hair with proper draping. During setup, you place the towel on the headrest. Fold the towel into a triangle from one of the top corners to the opposite lower corner and place it over the headrest with the fold facing down. The client places their head on the folded towel, and the esthetician now brings the ends of the towel up to the center of the client's forehead to cover the hairline. Use a disposable headband to hold the towel in place and a spatula to tuck in the hair. Make sure the client's earlobes aren't bent and the towel isn't too tightly wrapped. As always before a service, wash your hands with warm water and soap and put on gloves. Now you can check your client's skin before cleansing using the magnifying lamp or the naked eye. You want to see the skin's natural state before cleansing, and then again after cleansing. If not a pump bottle, always use a spatula to remove products from their containers. Clean and disinfect containers after each service. Begin cleansing the skin.
All right, let's look at this procedure. We're removing eye makeup and lipstick. This is something that we should also download because a part of the practical for your state board, you will have to show how to remove eye makeup and lipstick. You will have to do your facial on a mannequin, and basically the services you're going to do for your practical exam. Of course, there's a theory exam, then a practical. The practical exam is going to include a mini facial and a brow wax removal, okay, and a mini makeup application. All right. And so you will have to show eye makeup remover, and that's simply, of course, implement single use items and products. When I look at single use items, here, it says gloves. This is like gauze wipes, aesthetic wipes, cotton or gauze, disposable sponges, cotton swabs, spatula, tissues, unscented. Single use items will be used for predominantly all of your services. Okay. At State Board, you will have to have um, two two bags, one labeled single use, one labeled multi-use. Okay, in those bags, you will once you use the products, you will have to show the difference between single use and multi-use. So right now, anything metal is going to be a multi-use. I'm not going to throw away a metal item. Okay. If we had a towel, I'm not going to throw a towel away after the first use. So a towel is a multi use item, but a glove, I'm only using it one time. Okay. So I can't reuse the gloves. So gloves are single use and they must be thrown away in the single use container. Any form of cotton Okay, wood sticks that you use one time must be single use and thrown away in the single use container. Okay, looking at the eye makeup procedure, saturate 2 cotton rounds. Okay, use a cleanser, witch hazel. You also have the choice. Many people do use cleansers, but they saturate the cotton rounds. All right, ask the client to close the eyes, and they start with the left eye. And see, you always should have 2 hands on the face. One is going to do the work, the second hand is going to do the bracing. So the hand that's on the forehead, we call that the brace hand. All right. So whether you're left or right, you'll always have a hand on that forehead, and their forehead is going to be the brace hand. All right. The purpose of the brace hand is to make sure that if something comes near the eye, you have a free hand that can block it. Okay. So you have your brace hand, and then you have your other hand that is going to start removal of the product, the eyeshadow, whatever, across the eyelid. You're going to go down. Okay. You're going to go across. So you'll go across left and right, and then you'll go down. Across left and right gets the eyeshadow. Going down, it's going to get all the makeup or oil and dirt that's left on the eyelid. Get that off. All right. You're going to do the same thing for the following eye. So left and right eye, you'll get that done. Okay. You'll also take the wipes, you'll fold the rounds, and you'll wipe underneath the eyelids. Okay, we're removing the eye makeup. So you'll wipe underneath the eyelids. This moves mascara and eyeliner. Okay, all right. So you're going to make complete circles. Make sure you do what you have to do. Clean those eyes. Okay. We'll rinse the area with maybe a dry, clean round, and then we'll do the lips. This is very important for the lips. You're going to hold the lips, brace hand, hold them on one side, and you are going to wipe from left to right on the other side. Okay. So with the other hand, you'll wipe left to right. And you'll continue doing that procedure over and over until you have removed the lipstick. All right. So pretty much we're removing the eyeshadow, mascara, eyeliner, and the lips. Okay. Take the cotton rounds. You're going to go across the eyelids, and then you're going to come down. You'll also fold that cotton round and clean underneath the eye. Once you get the under eye done, you're going to go to the lips. You're going to hold the lips taut on one side, just kind of pull back, and you are going to take that wipe and go across the lips. You're going to do that left to right until all the lipstick is removed. All right. That's our main review for tonight. Just wanted to get into the videos, get into the pre prep. Well, what we did review was the setup, okay, supplies that we're going to need. Number two, how do we drape our client and get our client in the bed? Number three, the pre and the difference between the pre and the post service checklist. And next after that was removing the eye makeup, okay, and lipstick. So I just wanted to go over a few things, and we will continue to move next week and close out. I'm going to send you an assignment. This was just a study session for this chapter, but I'm going to send you an assignment for this chapter as well. Go ahead and complete, read this chapter. This chapter is going to set you up um, for the next chapters ahead.